Well, listeners, as I've been telling you this evening, we have a very special guest in the studio. We will be talking with Dr. Joanne Dsouza. We'll learn more about her, but let me our special guest, driven rather all the way from Para to be here in Altino. She had to cross one bridge and a little traffic, but she's here today. Very good evening, Dr. Joanne.
Good evening, Oreena. Thanks for having me.
Yeah, thank you and welcome back. We did meet probably a couple of years ago. Nice to see you here. And listeners, I've told you something about Dr. Joanne, but I think I would ask Joanne to go ahead and tell our listeners what exactly is it that you do, and what is this Parkinson's Society that you're a coordinator of?
Oreena, thanks for the wonderful welcome. I am a physiotherapist by profession, and I've been working with the Parkinson's Disease and Movement Disorder Society in Goa since its inception, 2013, and I've taken over as a coordinator since 2016.
Okay.
As a physiotherapist, I also work full-time at the district hospital in Mapsa. But my interest lies in working with... I've been with it for the society for about 11 years. So it's been my... it's very close to my heart.
It's like a passion project.
Yes.
And despite being so busy. Joanne, as a coordinator of this Parkinson's Society, what is your role here? And how do you manage all the hats that you already wear?
Our primary role is to provide rehabilitative support for people with Parkinson's. We are not involved in the diagnosis of the condition, but we are responsible, or we spend a lot of our efforts to give awareness towards the condition, because a lot of people are not aware about Parkinson's or its effects, or that they could be having Parkinson's as well. And once the diagnosis is made, this is a condition which is progressive in nature. So if they are detected with Parkinson's, somewhere slowly down the line, they are going to get worse.
Yeah.
And our role is to provide rehabilitative support free of cost.
Okay.
And we do this through our support groups in Goa. So we have 3 support groups.
So when you say you're the coordinator, that is what you do, right? You connect with all these groups, is it?
Yeah, so as a coordinator, I'm responsible for their assessments. They contact me when they get in touch or they come to know about our society, and I will assign them according to which area they live in. And we have a group of very dedicated physiotherapists, psychologists who conduct these sessions. So we have them either weekly or fortnightly. So this is how we manage the...
Okay, that's how you manage this whole program that you are looking after. Okay, we'll get back with more. I mean, we are here till 5 o'clock and on. So there's lots more to talk about. That is Dire Straits there with Industrial Disease, taking the time to 20 minutes past 4 o'clock. To all of you listening to us on the app, it is News on Air. Welcome to the program. I'm talking to Dr. Joanne. Dr. Joanne, as you said earlier in your introduction, that, not very many people are still aware of Parkinson's disease. So let me ask you, what is Parkinson's disease and what typically are the signs of Parkinson's? Also, I want to know, what are the early signs of it, whether there are stages of Parkinson's, is it genetic?
So Parkinson's is a neurodegenerative condition.
What do you mean by that?
So it's basically, it affects the basal ganglia in the brain, and it is basically because of the deficiency of dopamine, which is a neurotransmitter. So when I say neurodegenerative, it means that it is progressive in nature, and the early stages or the early signs could be, it's variable, it is never the same. Okay, so sometimes it may the most commonly associated feature with Parkinson's is the tremors,
yeah.
But it is a myth to believe that everybody who has Parkinson's will have a tremor. There are some who do not have a tremor at all. It could just be some of the other symptoms like rigidity or stiffness. Then there could be slowness of movement, postural instability, which means the person will have a lot of walking difficulties. They tend to have falls, especially when they're getting up from a chair, while they're moving around. They may have all of these difficulties. And these are some of the... So it is different from person to person. There's also people who have a lot of non-motor symptoms, more than motor symptoms, such as constipation or sleep difficulties or depression, anxiety, speech difficulties.
But they wouldn't really think that it's Parkinson's, right?
Yes,
because it's so common to different other disease as
yes,
well.
so that is the reason why the diagnosis needs to be made by a neurologist who is able to give you, because this is they have a certain clinical signs and symptoms, and a neurologist will be able to give you this diagnosis of Parkinson's.
Is there an age group, or can anyone also get affected? Like,
So,
I mean, especially in today's day and age, when you just listen in, or whatever you read and you hear from people, you feel that it affects even younger people.
So actually, there is something known as young onset Parkinson's disease, where like how you said, that it can affect even the younger population. Though a majority of our patients, even at our support groups and everywhere, are in the senior citizen group.
Okay.
We also have the youngest Parkinson's patient at our support group is just 35 years of age. So there's a concept. It's not only for the seniors; it can also affect the younger people as well.
Okay, and are there stages? As I asked you, are there stages of Parkinson's disease?
So there are 4 stages of Parkinson's according to particular clinical classification. So as I said, it is progressive in nature. We normally we encourage people to join the support groups very early when they get a diagnosis, because that is where you can really you can get the maximum benefit. They are able to prolong their have a better quality of life.
Okay.
They'll get into an early exercise programs. We have a lot of cognitive therapy, art-based therapy, which new research has said really helps to keep the progression of the condition at bay. So that is something we will always encourage, to join the support groups early on. There's also benefit in the later stages of Parkinson's, but so as you go to the next stage, it's always worse than the earlier
stage. And doctor, also is Parkinson's genetic?
So a very small population, you could say just about 2% of the number of Parkinson's patients do have a hereditary component. So it is most of the time idiopathic. So there's no known cause for what causes Parkinson's.
Okay. Doctor, can you tell us about exercise, which is it like very vital in managing Parkinson's in regards to their mobility, flexibility?
So exercise forms a very important and one of the biggest part of managing Parkinson's disease. There's a lot of recent studies, actually. There's a lot of studies going on in Parkinson's, mainly because we don't really know a cause of what causes it, what can help it. There's no cure. And there's a lot of research also going on as far as rehabilitation is concerned. And it has been seen that in recent studies that physio interventions, they provide a lot of evidence of short-term but significant and clinically important benefits of especially in balance, in mobility, walking speed, all of these things. An additional benefit of exercise, is also associated with reduced risk of developing Parkinson's disease.
So what are the kind of exercises that you have? Some regimen of exercises, certain like standard things that you would do with the patients who come there?
So we focus a lot on the holistic. So sometimes we will take up upper limb exercises, lower limb exercises, aerobic exercises, strengthening exercises, all of these things.
So this is also something that they could do on their own with at home.
Yes, but the problem is the motivation. So with exercises, you need a lot of motivation to get through it.
Even with us now, I mean, if we don't do it once and we forget to not forget, laziness comes into play. So if they have to do it unchecked at home, there's a higher chance that they may not be doing it enough, or they might not be doing it correctly and probably injure themselves.
Yes. So what we do is we also have, since we have trained physiotherapists conducting the sessions, we are able to provide them feedback, and they go home with a handout and they can do their exercises at home, and they'll come next week and they will do it together with other people with Parkinson's as well. So that's an additional boost.
Yeah, that's motivation, right?
Yes.
Knowing that there are also other people in the same boat and we are all in it together.
Definitely, yes.
Also, doctor, what is the self-care that we talk about, especially when we're dealing with the Parkinson's, and how is it that they function?
So self-care basically means also, putting yourself first. It happens. This is the focus that we this is the focus of our caregiver support groups primarily. A person with Parkinson's has a lot of issues, which could be mobility based, or it could be mood disorders. All of these things, and looking after someone with Parkinson's is not an easy job. It is a full time. It requires full time care from the family, and a lot of patience, efforts, and many a times the family members tend to put the person who has Parkinson's first and neglect their own health. So when we talk about self-care, we provide also support for the family members. We have an online support group. We meet once a month where we look at care or self-care for, and we focus a lot on that for the family members. We deal with issues that they may be facing at home with their loved ones, as well as how they can take care of their own mental health, because that's also essential.
So this is for the carers who are looking after their family members.
It could be a spouse, father, mother, anything.
And at these centers, do you all give them like special training? Are they trained, or it's just general
So this is an online support group. So they join online.
Okay.
And we take up a different topic every month. So 1 month we'll focus on maybe it could be mobility difficulties or traveling with the loved one who has Parkinson's. All of these things. So then we also take feedback from them. What do they want to hear about?
Okay.
And some component of this session is about self-care every time we have this session, because it's something that we need to focus a lot on. Mental health.
There was a query here from Mr. Joe in Margao, and he also, I think the same question was something on self-care. So we've already kind of answered that. Going online is something for them.
Yes.
That happens. How many times did you say?
Once a month.
Once a month online. Okay. Dr. Joanne, I have a question here from Preeti in Saligaon, and she has asked, is Parkinson's disease a disability which you can avail of a disability certificate?
Yes, it is a condition where you can avail of a disability certificate.
Okay.
In Goa, you have to go to the Goa Medical College,
GMC,
where you can get the help required. It is OPD 17 that you need to visit, and they will guide you according to which doctor to meet. It's something where you have to take the person who has Parkinson's. They will need to be assessed, and then they will be provided with a disability certificate. Following which they will have to also apply for the unique disability ID card.
Okay.
And then they can avail of the benefits available for people with Parkinson's.
What are the kind of benefits do they get?
There are benefits related to travel, railway travel, bus travel.
Okay.
Depending on the income status, there's also they can also get some money from the social welfare department, but that is based on the income and all of those things.
Okay. Dr. Joanne, also Parkinson's, patients with this disease, what are the kind of meds? I mean, are those meds very pricey? Do they have a health insurance that covers a package like covers their costs? Are you aware of
the main medication that is given for people with Parkinson's is basically Syndopa or dopamine, basically. Levodopa medications.
Yeah.
And in a month, I think that comes to about 500 to 700 in that range, depending on how many. So as the progression of the condition, or there are more symptoms seen, the medications also increase. Unfortunately, I don't think there's any particular medical cover where the personal insurance or anything can cover this. This is something that when you take your insurance, you need to find out all of these things, whether it covers certain policies do cover medications. I think so. That's what you need to find out. They're really based on whatever policy available or health insurance is available.
Okay. We are talking to Dr. Joanne. So, Doctor, I'll go ahead and ask you about Parkinson's with care for the elderly.
After the lockdown, we've been focusing a lot on the healthy aging program and a geriatric program, because, like I said earlier, it's that in that population we get the maximum number of cases who have Parkinson's as you grow over 60. So we are supporting 6 old age homes in Goa, where we provide monthly sessions of healthy aging program, where we do a different session of exercise or cognitive care, something to keep them active both mentally and physically.
So this is you travel to these centers. You
yes,
go
so
to
we have physiotherapists
go.
who go there and who work with them and give them exercises. So that's a monthly exercise program, and then we provide also handouts and train their caregivers, so who work in the homes, so they can continue this program for the rest of the month.
So every month these homes are located all over Goa.
So at the moment we are focusing more on North Goa. So these are based in North. Eventually we plan to go adopt a few more homes all over Goa.
So this happens when, like, how do you do it? Once a month? Or?
So it's once a month based on the convenience of the therapist visiting the center, all of that. We don't have any fixed date, but it is a monthly exercise.
So other than an exercise program, they recommend diets and what have you? Or
no, we focus
only on the...
Because we are focusing on the healthy aging thing, mainly cognitive and physical exercises.
So how have those inmates there taken to this program?
So it has been quite productive. We've had lots of means they've been reporting feeling much better. There's less incidence of other ailments, backache, neck pain and all. And there's also a culture of doing regular exercises and not just a sedentary lifestyle that we normally see in old age homes, in aged homes.
Yeah, because what do they do the whole day? I mean, they are just there. So
then this animates them a little bit. They get to do exercises with the others. Sometimes we'll have an art-based session.
Yeah, I'm just going to ask you about that. Do you do that for them?
Yes, we have a dance movement session. We'll have an art-based session. We'll make them do a few cognitive activities where they have to pay attention and do it together and all of those things. So that is really quite stimulating and quite encouraging to see their participation as well.
Yeah, I know, I can imagine. And I hope you'll put in a lot of photographs on your Instagram page, and whatever. So it motivates the others, no? We can't see the pictures here, but I'm just imagining that.
So this is something our society is not only based in Goa. We are working all over India. So this is something that has been adopted all over. In various locations in India.
Right. And also on that note, recent research has suggested that gut health and Parkinson's are linked. And there was also, on one of these channels that came out, that is on that central nervous system. So do you think diet and lifestyle are a factor here?
Definitely.
Because they say all diseases start in the gut. So
yes. So generally we do encourage people to, I would definitely say, have a balanced diet, eat more of proteins and antioxidants, fruits and vegetables. All of these things really help you or go a long way in preventing all of these other conditions, neurological as well as other lifestyle related issues as well.
And this was just a recent study. So they were still checking on
so
whether there is a connection.
There is a lot of thing you can do, to prevent or to try to. Of course, we can't always be 100% sure that we are going to be able to completely prevent a condition. But definitely by adopting all of these things, you can have a much more.
So that is you use more probiotics, fiber, or like a Mediterranean based diet. That's what.
Yes, so basically cut down on carbohydrates and focus more on eating protein-rich food, or protein-rich food is and probiotics. All of these things are definitely beneficial.
September 8th is marked as Physiotherapy Day, or what they call as Physical Therapy Day, that they would say. And it's basically to talk about contributions like yours and other physiotherapists worldwide, and you're the unsung heroes. How is physiotherapy with Parkinson's connected, and also with general other programs? So how do you connect these two?
So physiotherapy or a physiotherapist is one of the backbones of our rehabilitation programs. So whatever rehabilitative programs we do, it requires a lot of physiotherapy intervention, like I said, focusing on leg strengthening, balance treatments, walking difficulties, so work on mobility, gait. Then there's postural difficulties also seen in Parkinson's. There is a stooped posture which many people with Parkinson's develop. So working on postural strengthening, neck strengthening, all of that.
So do you also do all those, when you go down to a physiotherapist and if you have a neck pain, suppose, they would put in those... what is this? cupping and needling, all those kind of treatments?
So that is not something we are able to do, because our work is mostly group therapy. It's not possible to use intervention, but certainly if a person needs that additional care, because there's a lot of back pain, and this year's theme of World Parkinson's Day, World Physiotherapy Day is focusing on low back pain. So in these conditions, definitely we would recommend they visit a clinic where they can get one-on-one care. So that is a separate exercise program, which is also what physiotherapy is all about. But what we are focusing is on community-based therapy. So because of that, we do exercises a lot on stretching, strengthening of the back and on all the muscles.
But a specific intervention, they would have to go and make an appointment
with a clinic.
With the clinic. Okay. And doctor, I want to know whether about some success stories. Here what I mean is that a certain patient came in this condition, and after meeting up with you all, what is their condition later on? If you kind of remember and recall anything like that in general, what you have encountered over all these years that you've been involved with the society.
So many a times we have people with Parkinson's come to us with this condition causes a lot of social isolation. So people, even from, they've had very busy lives, very active lives, lots of friends, but suddenly once they've been detected with Parkinson's, it's a completely different experience. Sometimes they lose their voice. So that is one challenge. Then, because of the tremors, they're not able to, they feel very uncomfortable in social settings. So they may drop their cutlery, drop their plate, not able to feed themselves. Sometimes they may have drooling and all of these difficulties. So that is something that causes a lot of patients to prefer to, I don't want to go anywhere, I want to be at home. And it's a completely different shift from probably what they've always lived. So we've got a lot of people like that, and when they come to the group and they see that there are others who may be in a similar situation, some of them are worse, it changes their perception about how we always encourage them, whatever it is, you live your life, go out, do not remain isolated. And that there's been a lot of change, and I think many patients have said that that once coming to the support group, we now feel much more empowered to go out, meet people, talk to people. We struggle still, definitely, but it's
much better than what they were when
definitely.
They first
So
came in.
yes, there's that. We are able to we feel more confident, we feel more happier. All of these things are something that we live for these moments. Of course, for us it is also very heartening to see them say these things. But these are some of the many success stories.
Yeah, many. I'm sure there'll be plenty of, and we won't have time for you to tell us that. But Joanne, how can each of our listeners who are listening in, help with this awareness? We are listening into the radio now, so it's going out to so many people out there. But each and every one of us, how can we help you in reaching your, target of spreading the awareness?
One thing that I would encourage all the listeners to do is speak about Parkinson's, or if you know somebody who could have a condition which there are some things that you can see like tremors or difficulty walking, tell people that it could be Parkinson's. Why don't you reach out to someone who can make a diagnosis? We have good doctors here in Goa who are able to make a diagnosis, and definitely knowing that you have a certain condition, it's much more empowering than not knowing. So spreading awareness, also being very understanding, having empathy for someone who may be having these difficulties. Nowadays in this fast paced life, it is very challenging sometimes to to have patience, or to sometimes you may need to really provide a listening ear or things. So that can really help. So if they know someone who has not just Parkinson's, it could be dementia, it could be any other condition, or just could be a senior citizen, spend some time and listen out, help them, try and understand what their situation could be, and definitely speak about.
And even I'm sure there are young, students listening in, or their parents listening in, wondering what they could do, in their career. So, something like your line, taking up physiotherapy, or even volunteering. Do you have volunteers?
Yes, we have very dedicated volunteers, many psychology students from all colleges all over Goa.
I see.
They have been a part, and they've been, it's sometimes they really surprise me. They've gone over and beyond. They come for all the sessions. They don't ask for, we don't pay them anything, no honorarium, but they still
come.
They're just for the joy of seeing someone really happy and being a part of this. It's a very uplifting experience.
Yes, and on that very positive note, of young people meeting up with the older people, we will have to conclude our session here today, because I can see the clock really ticking away, and we have the news bulletin that comes up under 4 minutes. So, Dr. Joanne, thank you so much for being a part of our program here today, where we spoke about Parkinson's. There's, of course, lots to talk about, and probably at some other time we can connect again. So, Joanne, thank you for being here, and all the very best to you and the work that you do. Doff my hat out to you and the youngsters and the older people that you deal with.
Thank you so much for having me here. It's been a wonderful experience speaking with you and spreading this awareness. Thank you.
Thank you.